10 shocking triggers of dementia most people overlook. Dementia is a progressive condition that affects memory, thinking, and overall brain function, making daily activities increasingly difficult. While many people believe dementia is simply a result of aging, the reality is that certain triggers accelerate its onset or increase the risk of developing it altogether. Understanding these triggers is crucial for those looking to protect their brain health and reduce their chances of developing dementia. Dementia doesn't appear overnight. It develops gradually due to a combination of lifestyle choices, medical conditions, and environmental factors that damage brain cells over time. While some causes, like genetics, are beyond our control, many triggers of dementia can be managed, avoided, or minimized through healthy habits and early interventions. In this video we will dive deep into some of the most common triggers of dementia, why they contribute to cognitive decline, and what can be done to reduce their impact. 1. Sleep deprivation and sleep disorders. A lack of quality sleep is one of the most overlooked triggers of dementia. During deep sleep, the brain clears out toxic waste products, including beta amyloid, a protein linked to Alzheimer's disease. If sleep is regularly disrupted, these toxins build up in the brain and contribute to dementia. Conditions like sleep apnea, insomnia, and chronic sleep deprivation can increase the risk of dementia by preventing the brain from properly resting and repairing itself. Studies have found that people who get less than 6 hours of sleep per night in midlife are more likely to develop cognitive decline in their later years. Prioritizing good sleep hygiene by maintaining a regular sleep schedule, avoiding stimulants before bed, and treating sleep disorders can help protect the brain. 2. Chronic high blood pressure and poor heart health. One of the biggest triggers of dementia is poor cardiovascular health. The brain relies on a steady supply of oxygen-rich blood, and any condition that disrupts blood flow can contribute to cognitive decline. High blood pressure, or hypertension, damages the blood vessels that carry oxygen and nutrients to the brain. Over time, this damage increases the risk of vascular dementia, a condition caused by reduced blood circulation to the brain. People with heart disease, high cholesterol, and a history of strokes are at greater risk of developing dementia because these conditions affect the brain's ability to function properly. Maintaining healthy blood pressure, a strong heart, and good circulation can significantly reduce the risk of dementia and slow cognitive decline. 3. Uncontrolled diabetes and insulin resistance. Diabetes, especially type 2 diabetes, is another major trigger of dementia. When blood sugar levels are consistently high, it damages nerves and blood vessels in the brain, leading to inflammation and cognitive dysfunction. Studies have shown that people with poorly managed diabetes are more likely to develop Alzheimer's disease and vascular dementia. Additionally, insulin resistance, a condition where the body becomes less responsive to insulin, can prevent brain cells from properly using glucose, their main source of energy. When the brain struggles to get the fuel it needs, cognitive function starts to decline. Keeping blood sugar levels in check through diet, exercise, and medication can help protect brain health and prevent diabetes-related dementia. 4. Chronic stress and anxiety. Long-term stress is toxic to the brain and can be a serious trigger for dementia. When the body is constantly under stress, it releases high levels of cortisol, a hormone that, in excess, can shrink the hippocampus, the part of the brain responsible for memory. Chronic stress also leads to inflammation, disrupts sleep, and increases the risk of depression, all of which contribute to cognitive decline. Studies suggest that people with long-term anxiety, PTSD, or untreated stress disorders are at a much higher risk of developing dementia later in life. Managing stress through meditation, relaxation techniques, exercise, and therapy can help reduce the impact of stress on brain health. 5. Poor diet and nutritional deficiencies. What we eat directly affects brain function, and a poor diet can be a major trigger for dementia. Diets high in processed foods, trans fats, and excess sugar contribute to inflammation, insulin resistance, and oxidative stress, all of which damage brain cells. Deficiencies in key nutrients like vitamin B12, vitamin D, and omega-3 fatty acids have also been linked to cognitive decline. Vitamin B12 is essential for nerve function, and a deficiency can cause memory problems and confusion. Vitamin D plays a role in brain health, and low levels have been associated with increased dementia risk. Omega-3 fatty acids, found in fish and nuts, help protect brain cells and reduce inflammation. Eating a brain-healthy diet rich in fruits, vegetables, lean proteins, and healthy fats, such as those found in the Mediterranean diet, can help reduce the risk of dementia and support cognitive function. 6. Excessive alcohol consumption. Heavy and long-term alcohol consumption is a well-known trigger for dementia, as it damages brain cells and disrupts communication pathways in the brain. Alcohol-related brain damage, ARBD, is a form of cognitive decline caused by excessive drinking, which can lead to memory loss, confusion, and personality changes. Alcohol also interferes with the absorption of essential vitamins like B1, thiamine, which is crucial for brain function. Chronic alcohol abuse can result in Wernicke-Korsakoff syndrome, a severe form of memory loss and cognitive dysfunction. Reducing alcohol intake or drinking in moderation can significantly lower the risk of dementia and improve overall brain health. 7. Smoking and toxins in the environment. Smoking is another significant trigger for dementia, as it contributes to oxidative stress, inflammation, and reduced blood flow to the brain. The harmful chemicals in cigarettes damage brain cells and increase the risk of vascular dementia and Alzheimer's disease. Additionally, exposure to air pollution, heavy metals, like lead and mercury, and toxic chemicals in the environment can also increase dementia risk. Long-term exposure to pollutants has been linked to faster cognitive decline and an increased risk of neurodegenerative diseases. Quitting smoking and reducing exposure to environmental toxins can help protect brain health. 8. Head injuries and concussions. A history of head injuries, whether from sports, accidents, or falls, can increase the risk of dementia later in life. Repeated concussions and traumatic brain injuries, TBI, damage brain tissue, leading to long-term cognitive issues. Conditions like chronic traumatic encephalopathy, CTE, commonly seen in athletes, are forms of dementia caused by repeated brain trauma. Wearing protective gear, avoiding risky activities, and seeking medical attention after a head injury can help prevent long-term damage that may lead to dementia. 9. Social isolation and loneliness. Surprisingly, loneliness and social isolation are powerful triggers of dementia. Studies have found that people who have limited social interaction or feel isolated are at higher risk of cognitive decline. The brain thrives on stimulation, conversation, and engagement, and a lack of these factors can speed up dementia progression. Staying socially active, engaging in hobbies, volunteering, or joining community groups can help maintain cognitive function and reduce dementia risk. 10. Chronic depression and mental health issues. Depression is not just an emotional issue, it is also linked to an increased risk of dementia. Long-term depression causes brain inflammation, hormone imbalances, and shrinkage of key areas involved in memory and thinking. People with untreated depression or a history of severe mental health disorders are more likely to experience cognitive decline. Seeking professional help, using therapy, medication, or lifestyle changes to manage depression can reduce the risk of dementia and improve overall mental well-being. Dementia doesn't happen overnight, and it is often triggered by multiple factors that accumulate over time. From chronic stress, poor diet, and lack of sleep to medical conditions like high blood pressure, diabetes, and depression, there are many contributors to cognitive decline. The good news is that many of these triggers can be managed or avoided through healthy lifestyle choices, early intervention, and better brain care. Understanding what triggers dementia gives people the power to take action early, reduce their risk, and preserve their cognitive function for as long as possible. Brain health is a lifelong investment. Taking the right steps today can make all the difference in the future. If you found this helpful, don't forget to like, subscribe, and hit the notification bell for more health-related content. Let's keep our brains healthy together. See you in the next one.